Okay, I think we're just buffering here. Zoom is talking to YouTube live, and I'm waiting till it's completely buffered, and then we will begin. There we go. Okay, welcome everyone. My name is Dr. Kimberly Sogge or Sogge, depending if you want to pronounce it the North American settler way or the original Old Norse way. Go. Okay. So what I would like to do today is yesterday we began a conversation about integrating somatic skills in psychotherapy. And we talked about some of the history of focus on the body and the soma in psychotherapy, and maybe debunking this myth that somatic interventions are a new approach in psychotherapy. That there's some kind of very recent in the last 10 years innovation. I would like to argue that integrating somatic skills in psychotherapy is actually honoring the very roots of psychotherapy. Yesterday, we went through some of our founders of psychotherapy back to Jean-Martin Charcot, Pierre Janet, Joseph Brewer, Anna O. or Bertha Pappenheim, Hippolyte Bernheim and Benjamin Rush, the founder of modern psychiatry, and even Sigmund Freud himself, who addressed the body in terms of how physical symptoms could represent the unconscious conflicts a patient was struggling, or as he termed it, the conversion defense. We talked about Wilhelm Reich, Alexander Lowen, 20th century Fritz Perls, the recent research of Bessel van der Kolk and the Justice Research Institute, the somatic experiencing research of Peter Levine, mindfulness-based interventions and their importance that they place on the body and understanding the body-mind system. And then the more recent contributors, the cutting edge of somatic internal family systems, somatic ego state therapy, and sensory motor therapy, all led by these brilliant and cutting edge female clinicians. We talked just a little bit about the vagus nerve and how vagal tone is a measure of cardiovascular function that facilitates adaptive responses to environmental challenges. We talked a bit about how low vagal tone is associated with poor emotional and attentional regulation in children, and universally is a marker of sensitivity to stress. We talked about how even on high intensity space missions, they're looking at increasing adaptability through transcutaneous vagus nerve stimulation, and the growing body of research on the importance of vagal toning, the vagus nerve, and various health issues, how the vagus nerve connects to multiple brain regions and serves as a control center that integrates interoceptive information and responds with appropriate adaptive modulation feedbacks. I gave an example here of the stressed out therapist and what their vagal tone can look like as measured by heart rate variability. There's a copy of mine looking in a strained state, and see the huge variation according to stress and relational issues. That was a parenting worry. That big spike in the middle of the night was a huge change in heart rate variability. And overall, how vagal tone decreases as we get older. So it's really important that both physically and psychologically, we look at ways to tone our vagus nerve. We looked at how the vagus nerve represents the main component of the parasympathetic nervous system and just how it oversees this vast array of incredibly important bodily functions, including our mood, immune response, digestion, and heart rate. So this superhighway between the brain and the gastrointestinal tract, and how it sends information, not just like a brain sending information and commands to the organs, but how there's this mutual communication where the organs are sending information to the brain via afferent fibers. So that was the background, focusing on the vagus nerve, some of the history. I hope you see that there is a deeply rooted practice, physiological and conceptual foundation for somatic interventions in psychotherapy. And so we really need to help our profession grow by getting more comfortable with working with the body. Now, this doesn't mean that we're directly doing touch interventions. That's definitely off the table, at least in my professional board in the province of Ontario. But that doesn't mean that we can't allocate important attention, integrate important information, and intervene in important ways with the soma and psychotherapy. So I'd like to suggest that first we begin with the mindfulness-based interventions and their revolutionary suggestion of just attending to breath. So I'd like to take 1 minute right now and just invite you to attend to your breath wherever you feel it the most easily. It's so common for me in psychotherapy to just interrupt a flow of narrative and just invite my patients to attune to what is happening with their breath. So starting now. Breathing in through the nose. Breathing out, not manipulating the breath. Just noticing how breathing continues even if you're not attending to it. And so this is really important information that we include in our self-awareness. How the breath is responding to the environment. And maybe how our relationship with our breath changes our behavioral repertoire, our perceptual repertoire, our emotional repertoire in cultivating a skillful response to our environment. So what did you notice there, just with your own breath as you were tuning in? And how often do you notice yourself tuning in to your breath and to your client's breath when you're in a psychotherapy session? I would argue that if therapists could really begin attuning to both their breath and to their client's breath in sessions, they would be tuning into an incredibly powerful river of information about their own availability in the therapeutic process, but also their clients' availability to the interventions that they're offering, whether they're cognitive or behavioral. So very often we're breathing just with this upper lobe of our lungs, we're breathing shallowly. And what we really have noticed with breath that we often ignore in psychotherapy is that there's a huge association between anxiety and panic and this heightened response to carbon dioxide. So this is well documented in the literature. Patients with panic disorder report more anxiety than comparison subjects. So this is known as CO2 hypersensitivity. So in CO2 or carbon dioxide hypersensitivity, anxiety in response to CO2 enriched air relates to a much higher risk for anxiety psychopathology. And research shows that among adults, CO2 hypersensitivity is related to anxiety, especially panic disorder, panic attacks, and anxiety-related traits. So as we attune to the breath, we can also do practices that assist our clients in increasing their exposure to high CO2 saturated breath. And let's do one little practice here with that. So following me, if you'd like to follow along, you breathe in through the nose. And then take a little extra breath to completely fill. And then blow out through the mouth like you were blowing through a straw. and hold for 3. And natural inhale and then rest. So as you pay attention to this, what did you notice? You know, this is a wonderful little brain hack to assist clients in building their tolerance for CO2-rich breath. And also, a lot of people report that this is quite relaxing. It's quite calming to the parasympathetic nervous system. So consider this as one of our first little practices for today for our vagal toning practice, activating the parasympathetic nervous system with a long exhale and then a gentle hold at the exhale. So you can bring this into any session. Just if you see an escalation in sympathetic activity, a tightening of the shoulders, a rapidness of breath, you can even just, I think this is really important, just to weave it naturally into a psychotherapy session. And if you really negotiate this in the therapeutic contract with patients, you'll understand that psychotherapy is not a social conversation. So there's a negotiated agreement for gentle interruptions to pay attention to maybe out of awareness habitual processes that are going on that are contributing to more conditioned reactivity or unskillful responses to internal or external stimuli, whether it's a thought or a memory or an external cue. I think the best moment in which to intervene in these habit patterns is when they're plastic and hot, when they're present in the situation. So we interrupt and we just invite attention to the breath and maybe even intervene with a little practice. And then to complete the self-reflective loop, we're inviting the patient to tap into their own wisdom and notice the state of mind, of the width of the perceptual aperture, of the behavioral impulses, of the emotion tone, when they can practice these slight changes in the breath. So that's just one little practice. And I think it's really important to understand that the exhale and the breath hold are related to the vagus nerve parasympathetic toning that we were talking about earlier. Another related activity that can really assist in practice, you don't need to be doing a somatic experiencing intervention. This can be integrated in any psychotherapy, again, where there's an agreement in the therapeutic contract to include somatic information and also skills and resources for supporting vagal toning as supportive touch. So this supportive touch is among the many related activities that can increase vagal activity via the pressure receptors buried in the surface of the skin. And these receptors are located through the whole body. And what's really important is that really firm pressure, or maybe if you are doing movement, a deep stretch can reach these receptors. So let's begin. Maybe this is one I will often do during a session. Hand on heart or center of chest, one hand on the other hand, and then just firm pressure. Let's notice that for a few seconds. Just pay attention to what's happening in your own body. And as one of my teachers said, believe nothing I say, go find out for yourself. So notice that this deep pressure is soothing. And really light touching or stroking might be more arousing, while a powerful pressure, just think of if someone that you really love gave you a big bear hug or a really firm handshake. These are more activating of the parasympathetic system. So experiment for yourself, feel the pressure on the chest. Another one I really like is crossing the arms and gripping the biceps or shoulders on the opposite side and giving a firm squeeze. Notice how that feels. And of course, for me, nothing beats a great bear hug from someone I love, but we don't often have that available right when we need it. So how can we give ourselves the love and support that we need? How about just noticing holding the face? So there's a ganglia, like a nerve center linked to the vagus nerve up here in the throat and jaw. So just holding the face firmly and maybe letting the neck relax and letting the face rest in the hands. If you like, you can notice my eyes close automatically. Just notice how that's experienced in the body, firm pressure on the jaw and neck. One I really like is just a firm massage at the base of the occipital area, right where the neck meets the skull. There's a little hollow there. So right where the vagus nerve enters the brain, just giving a firm massage there. So there's nothing that beats good relationship with yourself, good relationship with others, and lifestyle practice. And it's really important that we have a suite of tools for regulating our nervous system on the fly, both cognitive, affective, relational, but this somatic intervention of supportive touch is activating the relational systems for ourselves. So as we care for ourselves, we become more available for our own life and for the care for those around us. So some researchers on vagus nerve activation down in Florida say that almost anything that you find relaxing, whether it's meditation, deep breathing, is also associated with heightened vagal activity and parasympathetic nervous system activity. They have done studies in the past showing that patients with migraines have impaired vagal activity, and they've tried interventions for migraine, doing yoga and deep breathing practice, and then they found that a lot of these interventions activated the vagal nerve. And conversely, stress and anxiety are associated with that depressed vagal activity, which might explain why uh, the conditions of anxiety and stress allow for an increased risk for other illnesses. I mentioned in the previous video that I used to work at in a musculoskeletal unit, primarily autoimmune disorders and juvenile rheumatoid arthritis in a pediatric hospital. And we were very busy as psychologists because we really found that addressing the stress of both our pediatric patients and their family members had direct influence on a lot of their autoimmune related conditions. So I really want to invite these interventions for vagal toning, not as a replacement for medical care. It's really important to understand that we can be empowered through somatic interventions and psychotherapy and in our self-care and our lifestyle to really change our health outcomes. So body awareness and mindfulness practices. So one thing I've really noticed that's brilliant about mindfulness interventions is they help us increase our interoceptive awareness, as well as our proprioceptive awareness, particularly if we're doing movement as part of our mindfulness practice, mindful movement of any kind, whether it's yoga or qigong or tai chi, or even just mindful walking, can increase the proprioception and the interoception that can be cultivated through a good body scan can really build the neural pathways associated with the functioning of the body and our conscious awareness. So let's just begin now where you are, noticing the weight of your body dropping into your seat. And maybe the weight of your feet on the floor. And allowing your awareness, beginning at the top of your head, to move kind of like a mental MRI over the surface of your skin from the top of your head over your face and neck. Shoulders, upper arms, and chest. Through the spine, the belly, the hips, the legs, and just noticing any areas of tension or of ease. As one of my teachers, John Kabat-Zinn, said, can you notice your non-toothache? It's easy for us to orient to highly salient stimuli like pain or tension. It's not so easy to orient to ease, to freedom from pain. And so this is what we're cultivating with balanced body awareness, is opening to information, both pleasant, unpleasant, and also information that's neutral that we would usually skip over, because when we have this broad base of awareness, we can understand more about what we need and make more skillful responses, not responses that are entirely driven by our conditioning or verbal rules. So I mentioned earlier that Bessel van der Kolk and the Justice Research Institute had been strong advocates for yoga as an adjunctive treatment for post-traumatic stress disorder. So this is a randomized controlled trial led by Bessel van der Kolk at JRI and his research team. And one study there showed that trauma-informed yoga significantly reduced the symptoms of post-traumatic stress disorder. And the effects were comparable to very well-researched psychological and pharmacological methods. So trauma-informed yoga is an incredible adjunct to psychotherapy. I do not usually do yoga as the primary intervention in psychotherapy. However, I think it's really important that psychotherapists be open to integrating movement, even if it's amplifying a gesture. There's little gestures happening at all times in psychotherapy. I had one patient who, when talking about his trauma, his hands would float up like this. And it's a somatic experiencing practice, just to really slow down a movement and do it consciously rather than having it just happen to us, so we can see what information is there and how that might be related to needs for the completion of a trauma cycle. So this is a form of yoga, bringing conscious awareness to movement. And there were all sorts of images and information for that particular patient. This is yoga, the joining of the mind and the body in psychotherapy. At times, I will include specific yoga postures if we're trying to help a client orient to a different experience in their body other than the one that might be very familiar to them, of being highly coupled to being vulnerable or not being able to move or not being able to soothe themselves. I might consciously invite in a specific posture just so that we can explore a different experience than the one that's been conditioned by trauma or a past unresolved experience. So for example, a wide-legged child's pose can feel quite safe for many people, as long as you have a safe environment in which someone can practice it. And having the ability to put themselves in a different posture can be quite empowering to someone who has felt completely vulnerable to their trauma symptoms. One of the first things we want to do in trauma recovery, rather than going directly to the trauma, which is a rookie error for many therapists, we spend a lot of time resourcing and building safeness in the body, and particularly building a sense of capacity and empowerment, the ability to do something rather than be caught in that freeze or flight state that many people are caught in. So that's a brief comment on trauma-informed yoga. Here's another one of my favorites, and I really want to encourage psychotherapists, psychologists, clinicians to pay attention to the voice in therapy. You might notice the cadence, even in many mental status exams, we pay attention to the pressure and flow and cadence of speech, because it's a direct relationship to the diagnosis or the possible symptoms that a client is struggling with. For example, the pressured speech in schizoaffective or schizophrenia is directly related to differences in the language regions in the brain that are particular to these illnesses. So they can be part of the voice can be part of diagnosis and symptoms, but it can also be part of this vagal toning, the parasympathetic activation that we talked about as being so important as being part of the healing process. And think of it when you really are singing, like, come on, who hasn't been driving along the highway and your favorite song, you put it on your stereo system and just really sing your heart out. When we open up to sing that fully, especially songs that have like kind of a deeper resonance, kind of deeper down in the body, we are using our vagus nerve. And that nerve is such a big one, it's so long, it branches through so many organ systems in the body. And if you look at this diagram of the vagus nerve, you can see it innervates the voice box, the throat, the upper palate, and connects to the heart, lungs, and the digestive system. So you might already have noticed that you hum as a way to relax. And when we hum, our heart rate can decrease and our heart rate variability can increase. Remember, we wanted increased variability as part of our stress resilience. So heart rate variability, that's that fluctuation between each heartbeat, is highly associated with better health. So let's do two little practices that I really like to introduce into psychotherapy. And one is from my Buddhist meditation tradition. You can see how these ancient practices, which are really focused in the early stages on cultivating tranquility, are incredible for parasympathetic activation. And the first practice is just an Om. So the Om can go quite deep into the belly. I encourage you to try it along with me. Breathing in through the nose. Two more times. I'm smiling because my dog just sat up. He's coming to check. Hello, Vigo. This is Vigo Mortensen, who's my co-therapist here today. You can see him. Yep. Hi. Hi, buddy. You like the oming, did you? It's all right. Okay, he's going to come and sit with us. Hello, pup. So here's the second voice practice. This is from Peter Levine and Somatic Experiencing. And it's really to help people resource and regulate. Nobody, you can't sit on my lap while we're talking. And it's called the VU breath. So let's see what Viggo Mortensen here thinks about the VU breath. So here we go. Again, in through the nose. One more time. Notice how that feels in the body. Oh gosh, I find that so relaxing. My dog wanted to get in on it and come and sit on my lap. So notice how your system feels just after those ohms and after the VU breath. This is a lovely way for, again, for building a sense of autonomy and capacity when someone has felt really vulnerable in their nervous system and unable to downregulate. This can be an incredibly helpful way to work with your own body, humming or om or vu breath. So let's look at the next practice that I want to introduce you to is I really think that every approach, no matter what your theoretical or clinical orientation is, should be paying attention to these rivers of information that are going through the experience, the subjective experience of most of our patients. And in somatic experiencing, we're paying a lot of attention to overcoupling, meaning we all have preferences or conditioning where we attune excessively, perhaps, to one of these channels, and undercoupling, and for many of us, the sensations in the body, particularly for me, working with a lot of academics or highly trained professionals, they've kind of been highly rewarded for completely undercoupling from sensations and affect, so the S and A in SIBAM, but maybe highly overcoupled in the M, meanings, and then action, the behaviors. So just pay attention to what's true for you. Maybe even in supervision, I noticed this, that our habit patterns as therapists can cause us to attend to one channel more than the other. And this is totally okay if you have a therapeutic contract to focus entirely on cognitions. However, just be mindful that all these rivers of information have not turned off just because we've chosen to use a particular intervention. So to really titrate and adapt our interventions to individual client needs, I think it's important that we pay attention to these other channels of client experience, and also as therapists to be maximally flexible to attend to these channels of information in ourselves. So how can paying attention to these different channels, sensations, images, behavior impulses, affect, or the meaning-making channels help people heal from trauma? Well, as we create a complete experience, we identify particular channels and component pieces that can build a complete experience. And how we experience trauma is determined by our relationship to the experience fragments. So as I was mentioning, some parts of our experience get overcoupled or overemphasized, like maybe a sound or a smell in a traumatic situation, and others become undercoupled or underemphasized, like a bodily sensation. So through somatic experiencing, we're working on reconnecting and rebalancing the flow of channels in the SIBAM model. And by increasing the awareness and reconnecting and rebalancing the channels, it allows the body and mind to find an integrated pathway towards resolution of trauma and actually a deeper, broader experience of oneself. So that's more for an attending practice for therapists, but there are different interventions that can be brought in under each of those channels. Some specific somatic experiencing skills. We talked about body awareness. So one of the favorite phrases that one of my teachers, Urs Mensch, who is a European psychiatrist who teaches intermediate and advanced somatic experiencing, is asking, how is it now? So we want to increase the body awareness in our clients and support them to recognize their responses within the body and to evoke calming and skillful responses. Another specific somatic experiencing practice is orienting. So very often you'll notice our clients are focused on the story, and this is important that they be listened to and validated. However, these other channels, when they're undercoupled, might be really influencing their stuckness in their responses to a difficult situation. So we can invite attention in the present moment to contrast in the body. It's like, oh, there's so much pain in the jaw, but what's your awareness of how things are feeling in your hands? So noticing contrasts between the intensity of, say, a pain in a jaw and the non-intensity or stability and safeness in the hands. And we might also ask, and how is it to notice that? So noticing the noticing, we're helping clients orient to different aspects of their environment and really expand awareness of the contrasts in their own experience, that it's not all or nothing. Another specific somatic experiencing skill that I really love is titration. And I think this is really important. There are so many people who will drop out of exposure treatment. And I think this is a big reason why they often drop out, is we do have to be exposed and have to face difficult situations. But titration helps us do it in a way that's gradual. In somatic experiencing, we talk about taking little digestible bites rather than choking by taking a bite that's too big of experience. So it's a way of helping individuals process through a traumatic situation while noting and addressing physical sensations in a balanced way. So I always have fresh flowers. So this is a somatic technique, actually. I have fresh flowers or plants in my consultation room. And we might begin a session by just orienting to something that is life-giving. And then as we begin to address and increase sympathetic activation as we orient to difficult experiences, we titrate by noting, say, I'm at an 8 out of 10 now. Okay, let's come back and focus on just the light coming in through the window. I also have very beautiful paintings in my office that are quite soothing. So focusing on something resourcing to help the system re-regulate, and then going back into focus on the challenging situation. So we have to stay tuned with titration. And what I was just describing there could easily turn into pendulation. So that's where we guide someone from a relaxed state into more challenging states and then back to relaxation. So we're kind of weaving together that sense of exposure to a challenging experience, but then coming back into regulation so that the nervous system stops reading every bit of information associated with a difficult experience as a need for fight, flight, or freeze, but can instead learn how to integrate the information in a more balanced way, and not treat it as a threat in this moment the way it was in the original moment of trauma. And then the last one has been woven through all of our discussion about integrating somatic skills into psychotherapy, and that is resourcing. And I often will teach patients, like, let's have an 80-20 or maybe even a 90-10 focus on resourcing. So often we are rewarded and trained to be oriented through drive and through threat systems. And in one of the approaches I really like to use, compassion-focused therapy, we consider often the orientation to drive and to threat responses as being caused by an underdevelopment of the affiliative and care networks. And resourcing can really help us correct that imbalance in our affiliative and care networks by focusing on resourcing, recalling people and places associated with feelings of safeness, feelings of being held, feelings of having capacity to respond. So that is the world's shortest introduction to some specific somatic experiencing skills. And I would just like to say, the first thing that you can do to integrate somatic skills into psychotherapy is to allow your own nervous system to be well regulated, to use all these practices on yourself to cultivate your own physical health and well-being in your body, because patients can feel it. They can feel whether you're present or distracted in the psychotherapy context. And I would argue, although it might be more difficult on the era of telepsychology and teletherapy, there is a nervous system co-regulation that happens. And this might be one of the most powerful things that we offer in psychotherapy, is that the health and balance of our own nervous system. So I like to say my nervous system loves your nervous system. This presence of the therapeutic relationship is increased by our own capacities for parasympathetic regulation and our own attentional capacities to attune and read the information of all these somatic channels in our clients' experience in the psychotherapy context. So allow the therapeutic relationship, your physical presence, your physical embodiment in the psychotherapeutic relationship to be a resource for your clients. Let your nervous system love their nervous system in a way that is healing, non-demanding, and perhaps transformative in a way they've never experienced before. Thank you so much for your attention. Feel free to reach out to our team for more conversation about integrating somatic skills in psychotherapy. We offer mindfulness workshops, retreats, case consultations, and individual and group sessions in process-oriented psychotherapy, compassion, and mindfulness. Thanks again for your care for your clients, and I hope that we cross paths somewhere in this journey of healing. Bye-bye.